Mesothelioma is a type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. It is usually caused by exposure to asbestos. The mesothelium protects organs by producing a fluid that allows different internal organs and tissues within the body to move smoothly against each other during normal body movement and functions. There are three main types of mesothelioma based on the specific area of mesothelium affected. Pleural mesothelioma develops in the pleura, which is the thin layer of tissue that surrounds the lungs and lines the interior of the chest cavity. This is the most common type, accounting for around 70% of mesothelioma cases. Symptoms of pleural mesothelioma often do not appear until the later stages of the disease and may include chest wall pain, shortness of breath, chronic cough, weight loss, and fatigue. As the cancer grows, it can cause fluid to accumulate in the pleural space, which can make breathing increasingly difficult. Physical signs may include an enlarged liver or swollen neck and face veins as the tumor puts pressure on nearby structures. Peritoneal mesothelioma develops in the peritoneum, which is the thin layer of tissue that lines the inner wall of the abdomen and covers most of the abdominal organs. Symptoms of peritoneal mesothelioma may include abdominal pain or swelling, abdominal distension, bloating, gastrointestinal problems, bowel obstruction, blood clotting abnormalities, and weight loss. A physical exam may reveal an enlarged abdomen and masses that can be felt. Pericardial mesothelioma develops in the pericardium, which is the sac-like covering around the heart. This form is very rare. Symptoms can include chest pain, shortness of breath, and fluid buildup in the area between the heart and pericardium. In order to diagnose mesothelioma, doctors will consider the patient's medical history including possible asbestos exposure, conduct a thorough physical exam, and order various diagnostic tests. Chest X-rays and CT scans can show abnormal thickening and masses in the lining of organs that may indicate mesothelioma. Fluid in the lining of the lungs may be detected on a chest X-ray for pleural mesothelioma. Further imaging tests like MRI or PET scans provide more details on the exact location and size of tumors. Blood tests can also help detect suspected mesothelioma by showing elevated levels of certain substances released by cancer cells. However, the only way to get a conclusive diagnosis of mesothelioma is through a biopsy, which involves surgically removing a small sample of tissue from the affected area for examination under a microscope by a pathologist. If mesothelioma is diagnosed, additional tests may be done to assess how far the cancer has spread from where it is originated, known as the stage. Staging helps determine treatment options and the patient's prognosis. Treatment for mesothelioma depends on the stage and type but often involves some combination of surgery, radiation therapy, chemotherapy, or targeted drug therapy. For pleural mesothelioma, surgery may include the removal of part of the lining of the lung or chest cavity. Complete surgical removal of peritoneal mesothelioma may sometimes be possible. Radiation therapy uses high-energy rays to kill cancer cells and shrink tumors. Chemotherapy involves the use of anti-cancer drugs that work throughout the body to destroy cancer cells. Targeted drug therapies interfere with specific molecular pathways that allow cancer cells to grow uncontrollably. Supportive care also plays an important role in relieving symptoms of the disease. The overall prognosis for mesothelioma is generally poor due to the fact that it often spreads easily and does not always show symptoms until advanced stages. However, outcomes can vary significantly depending on multiple factors like the specific type, stage of diagnosis, molecular features of the tumor, response to treatment, and the patient's overall health. Pleural mesothelioma has a worse prognosis than peritoneal mesothelioma. The average survival time after diagnosis is often measured in months rather than years, with risk of recurrence remaining high even after potentially curative treatment. However, new immunotherapies and combination therapies are showing some promise in improving survival rates, quality of life, and even cure for some. Overall, early detection when the disease is localized remains the best predictor of a favorable outcome. Symptoms of mesothelioma and how it is diagnosed. Mesothelioma is a type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the lungs, the heart, and the abdomen. It is usually caused by exposure to asbestos. The symptoms of mesothelioma may not appear until 20 to 50 years after exposure to asbestos. Some early symptoms include chest pain, pain in the chest that may worsen with deep breathing, coughing, or laughing. The pain is usually on one side of the chest and can radiate to the shoulder or back. Shortness of breath. Over time, fluid may collect in the chest cavity, pleural effusion, which can make it difficult to breathe deeply. Cough. A persistent dry cough or coughing up blood. Coughing may worsen over time. Weight loss. Unintended weight loss and loss of appetite. As the tumor grows, it can prevent the lungs from working properly and absorbing nutrients from food. Fatigue, constant tiredness and lack of energy. It becomes difficult to do normal daily activities. As the disease progresses, additional symptoms may develop including difficulty swallowing, also known as dysphagia. This happens as the cancer grows and presses on the esophagus. Swelling of the abdomen. Ascites is a buildup of fluid in the abdomen which causes swelling. This happens when cancer spreads to the sacs surrounding the intestines and blocks the returning blood flow from the abdomen. Clubbing of the fingers and toes. The fingers and toes take on a bulbous, widened shape. This happens as the oxygen levels in the blood drop due to lung scarring or fluid buildup. Mesothelioma is often difficult to diagnose correctly as its symptoms are similar to other more common conditions. The diagnosis usually involves a thorough medical history, physical examination, labs, imaging tests, and tissue sampling via biopsy. The doctor will ask about the patient's history of asbestos exposure, including their occupation, hobbies, places lived and traveled. An occupational history is key as many jobs like mining, shipbuilding, insulating, and firefighting carried higher risks of exposure in the past. A physical examination focuses on listening to the lungs and heart for abnormalities, feeling the lymph nodes for swelling, and examining the abdomen for fluid buildup or masses. Simple blood and urine tests help rule out other illnesses or infections. Imaging tests like chest X-rays, CT scans, or MRI scans provide a more detailed look inside the body. X-rays and CT scans are usually the first tests ordered to look for signs of growths, fluid, scarring or thickening of the pleural lining. Pleural effusion seen on X-rays or CT scans need to be analyzed with thoracentesis. Thoracentesis is where a long needle is inserted between the ribs to collect and analyze pleural fluid. The fluid is tested for tumor markers, abnormal cells, and types of fluid. Light's criteria is used to determine if the fluid is an exudate versus transudate, which provides clues about the possible causes. A tissue sample via biopsy is usually needed for a confirmed diagnosis of mesothelioma. A biopsy may involve thoracoscopy, where a tiny camera is inserted between the ribs to visually inspect inside the chest. Small samples of visible growths or fluid in the chest cavity are collected. Sometimes CT-guided needle biopsies are done, where a hollow needle is precisely guided by CT scans into tumors, chest walls or lymph nodes to extract small tissue samples without surgery. The samples are sent to a pathologist who examines them under a microscope for the presence of malignant mesothelioma cancer cells. Genomic tests can also help differentiate mesothelioma subtypes. A definite diagnosis of mesothelioma requires identifying mesothelial cells with certain patterns on histopathology from biopsy specimens. The different subtypes like epithelioid, sarcomatoid, or biphasic also provide valuable information about aggressiveness and treatment options. An experienced cancer specialist called a pulmonologist or oncologist is usually involved in making a confirmed diagnosis of mesothelioma after integrating all test results and risk factors. Mesothelioma has various nonspecific early symptoms that are often overlooked and confused with more common conditions. Its diagnosis requires considering an occupational and risk factor history of asbestos exposure, examining imaging tests for lung abnormalities, analyzing pleural fluid samples and most importantly finding tumor cells on biopsy specimens. An accurate diagnosis is important for determining appropriate treatment and management.